Hello, and welcome to the fourth season of Academic Matters. I'm Joe Marbach, the Provost at LaSalle University. In this first segment, I'm joined by Dr. Joseph Seltzer, who is a professor in our Management and Leadership Department. Joe, welcome to the program.
Thank you very much for having me.
Oh, it's a pleasure. Joe, for folks who watch the show regularly, they get to know a little bit about our faculty and their backgrounds. Can you tell folks watching a little bit about yourself and how you ended up here at LaSalle?
I worked on my doctorate at the University of Pittsburgh, and when I was finishing, I was looking for a place, and I was particularly looking for two things. One is a place that valued teaching. I do lots of experiential learning as part of my teaching, and I wanted a place that was comfortable with that. And I also wanted a place where I would have some colleagues. And I interviewed at several places where the person who I was replacing would have been a good colleague, except they were leaving, which said to me, this is not a place I want to be. And I had the opportunity to meet Bruce McLeod, who was at the time the dean, as well as two other faculty members at the Eastern Academy of Management meeting. And I was given a first interview there, and then I subsequently had an interview on campus. And it was the focus on teaching that particularly attracted me here initially.
Okay. Elaborate on that. What is it about teaching at LaSalle that's different than at other institutions? What is it about that teaching component that drew you here?
Well, in my case in particular, I do many things that try to actively involve students in the classroom. And that was, at the time, and still is to a smaller extent, somewhat unusual. So that other schools that I know of other schools certainly that do this, but there were other schools where they kind of expected you at, I've been here for 39 years, so this is a long time ago. Mm-hmm. But they expected you to basically stand up and lecture. And I don't see that as one of my strengths. Instead, creating a setting where people learn, I think, is one of my strengths. Yeah. And so I create structured activities for people to do in a classroom that will bring out a point or present an opportunity for someone to have an experience that they can then look at and talk about as a way to learn.
One of the hallmarks that I like to brag about LaSalle to folks, and it's really from our Christian Brothers tradition, is a sense of practicality of education. And it sounds to me that that's at the heart of what you're doing in the classroom, making it practical, making it real, giving students a quote-unquote real-life experience.
Just to pick an example, about 20 years ago, my colleague Jim Smither and I wrote a series of activities to do about leadership, where each person participated as both a leader and a subordinate. The setting brings in a new sales manager, and you need to talk to the people that are working in your department. And so 3 other students in the class would play a role play, and you would meet with each of those people. But the practical part of that is that we tie that very directly to a specific leadership theory called path-goal theory. And the student participates in about a 5-minute role play, just the 2 of us sitting together. Mm-hmm. And at the end of the role play, you're given a questionnaire to rate me as the supervisor. I also rate myself. And I'll go around and meet with 3 people. And at the end of that, then there's a feedback session where you give me feedback on my leadership style. And then there's another whole set of role plays, which is the same people, but just with different roles, and set a few months later, where you're now the supervisor and I'm the subordinate, and you meet with 3 subordinates and you get feedback. We do this routinely in the MBA A10 class as part of our assessment workshop. And in fact, I just did that a couple of days ago, with people. And we've been doing it for 20-some years.
Okay. Well, it begs a question. As I mentioned, you're part of the Department of Management and Leadership. How do you teach leadership? Isn't leadership inherent, or are you telling folks at home they can learn to be leaders?
I think that among the variety of approaches to thinking about leadership, certainly there are approaches that say that leadership can be learned. You can learn to be more effective as a leader. If I didn't believe that, it wouldn't make much sense to try to offer leadership. But I do definitely believe that that's true. The research also supports that. There have been studies that have tried to look at what's inherent about leadership, and mostly those have been, those theories that were presented at one time are largely discredited. It just doesn't make that much difference. In studies of, for example, in a study I know of, a very large study that was done where they looked at people's job applications and they looked 10 years later and to see how effective they were, which people had gotten promoted into leadership positions and how effective they were. They found that the single best predictor of how well the person would do as a leader 10 years later was a question that probably they weren't even interested in, but just got coded into the thing, which was, can we go back to your former job and ask for a recommendation? And people that said yes were more effective leaders than people that said no. In other words, people that were effective in one job tended to be effective in other jobs.
It would carry over.
And it's leadership is certainly something in my mind that can be learned. Now, you can also learn to be ineffective if your experiences are only with leaders that are poor leaders. It's hard to be an effective leader. But theory helps you build that opportunity to become better.
So in the leadership program, or that component of the program, is it principally case studies and skills that you're working with students to develop? Or
I personally don't use case studies to a great extent. My interest is more in structured activities, and I probably have written 35 or 40, written and published 35 or 40 structured activities that provide opportunities for people to learn about theories, get some feedback about their own individual skills, just as I described a couple of minutes ago. That was published in 1995 in the Journal of Management Education. And I continue to do that. That's been, most of my career has been about pedagogical publications.
Yeah, and I did want to touch on that, Joe, because as you mentioned, you were attracted by a place where you could teach and be effective and experiment with different ways. But you've made a career, literally, out of teaching teachers how to teach. Has it been exclusively in leadership, or other elements of management as well?
Just management in general. I've always found it interesting to think about what can I do to present this material in a different way in a class, and frequently that involves creating a structure in which or during which one can learn some lessons about that content.
Now, at many universities, that kind of scholarship might be discounted. It's not real management theory. It's teaching about pedagogy. What makes LaSalle different?
Well, one is that we do in fact accept that, although that's right now, the AACSB, which is our accrediting body, considers scholarship of two types. They consider traditional scholarship, and they also consider scholarship of pedagogy as a legitimate aspect of what one does. And so I have done that primarily. I have published in more academic journals as well, but much of what I've done, especially for about the last 20 years, has been focused on improving teaching. So that some years ago, I co-authored a book of exercises to use in the classroom I routinely present at two conferences that I attend every year. One is the Eastern Academy of Management, which has an experiential learning association that I actually am one of the co-founders of, that does experiential activities at their conference. And the other is the Organization Behavior Teaching Society, which also does experiential activities at their conference. I happen currently to be the president of that organization.
Okay. So this is, you really practice what you preach
Yeah.
in a lot of ways. What's next? Where's the direction of experiential, or sometimes it's called engaged learning? Where do you see it going in terms of the business world?
I think that, at least in the short run, trying to find ways, the new standards for accreditation focus on the idea of impact. And finding ways to demonstrate impact is a current interest of mine. It's clear that impact on a scholarly journal is relatively easily measured by seeing how many other scholars cite that article. This was important in my thinking and therefore gets cited in my article. But in fact, the people that should be citing an activity in class would be the students in the class. So that the exercise that I mentioned before, it's called the Pat Howard Role Play, was published in 1995, has been downloaded from the website at least 700 times, has been presented to at least 2,000 of our students, and has been cited exactly once.
Really?
And I'm trying to make the case, and I made conference presentations at 3 conferences this year, specifically about how can one measure impact for those sorts of publications.
Well, Joe, it's going to wish you luck in doing that as you move forward. We're out of time. Thank you for joining us in this segment.
Well, thank you.
You're welcome. Please stay tuned. As we come back, I'll be joined by Dr. Cesar Ruiz of our Speech Language Hearing Program.
University's communication department, students learn to think and do.
Every semester, communication students create and implement public relations plans for local nonprofit organizations.
And journalism students produce Germantown Beat, an online news source for the local community.
It's great that we can apply what we learn in the classroom in our community.
Philadelphia is the nation's 4th largest media market and has 4 major sports teams.
Being in a major media market allows us to gain great professional experience through internships and co-ops.
The Communication Center is home to the university's cable station.
LaSalle TV reaches over 350,000 homes in Philadelphia and airs mostly student-produced programming.
Our communication department is ranked in the top 10 in North America for relational communication research.
But keeping with the tradition of the De La Salle Christian Brothers, teaching students comes first.
Think, do, with LaSalle Communication. Check us out on Facebook and Twitter.
Hey fellow TV viewers, are you bored? Are you tired of the same old shows? Having thousands of channels to watch, but there's nothing there? Tired of sitting by yourself on your old mama's striped couch? Sitting in your room by yourself, watching someone who resembles your grandfather? Yeah, I know. I used to be just like you. By now, all hope is lost. You're flipping through channels, wondering what to watch. Boring, 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 boring. Wait, what's this? LaSalle TV. It's new, it's bold, it's great. It's not your ordinary TV.
Welcome back to Academic Matters. Once again, I'm Joe Marbach, the Provost at LaSalle University. In this segment, I'm joined by Dr. Cesar Ruiz, who's an associate professor in our Speech Language Hearing program, which is located in the School of Nursing and Health Sciences. Cesar, welcome to the program.
Thank you for inviting me.
Oh, it's a great pleasure. I know you're doing some cutting-edge research, and especially with swallowing and things like that I want to talk to you about that many programs don't have. But before I get into that, tell the folks at home how you ended up here at LaSalle and what attracted you to come.
Well, I'm originally from Venezuela, so I came here 33 years ago to the United States, first as an exchange student to a high school, and then I went back home, and I was hired by Ford Motor Company in Venezuela as an interpreter. So then 2 years later, I decided to come back to the United States to become an interpreter, and I had the opportunity to go to St. Louis University, and they didn't have the school for interpreters there, so I just joined as an undecided student, and they had a career awareness day where they were showcasing speech pathology, and it attracted me, and before I knew, I had my bachelor's and my master's in speech pathology, so I left aside the interpreting purpose that I had and became a speech language pathologist.
Okay. And then how did you end up at LaSalle? Was there something in particular that attracted you here?
Well, I came to the hospital at the University of Pennsylvania where I was doing my practicing my medical speech pathology. And then as I was there, I began my doctorate program. And luckily, they opened a new program here at LaSalle University. And I saw that advertisement for a faculty position. So I applied to that and was accepted. And I gladly accepted it as well. One of the things that attracted me was the fact that I discovered that I was a LaSallian. By just learning about the mission, learning about all the information about LaSalle, I said, yeah, this is me. So after being at the Hospital University of Pennsylvania for 10 years, it didn't hesitate to change.
Well, I know how connected you are to the students. I get the honor and privilege to attend your graduation ceremonies in what is one of our top programs at the university, especially as measured by the success of our students, where we have, 99.9% placement and passing the licensure test. And I see how the students take to you and your involvement with them and their lives. Is that what you mean when we talk about being LaSallian?
Yeah, being LaSallian, one of the things that helped is the fact that I had a lot of practical experience before I came here. So then I bring that to the classroom, and not just the theory part, but being able to talk about cases and showing videos of things that I do. It's not just showing somebody else's experience. So that, and then they also participate in the class. So I teach a course that is called instrumentation, and some of the things that I do, as you mentioned earlier, is to work on dysphagia, which is swallowing disorders, and voice disorders. And one of my specialties is to do endoscopies, which is not necessarily something that all speech pathologists do. So bringing that equipment into the classroom and scoping myself or allowing the student to scope me, it's a big seller.
You weren't involved in the Joan Rivers thing, right?
No. It was in New York this year.
Right.
No, but it's in order to evaluate swallowing and evaluate the vocal cords for voice, you have to visualize it. And so it is within our scope of practice to do that.
Yeah. And that's unusual, isn't it? Most programs don't have that component.
Yeah, and there's not that many even in the Philadelphia area that would do that type of evaluations.
So does that give our students a leg up? Are they able to, is it a skill set that
those who are
interested,
them? Those who are interested, because we have basically two tracks. We have the school track, and then we have the medical track. And so students decide where they want to go. So those students who decide to do the medical aspect, they take those electives that will prepare them.
And they would work in a clinical hospital setting?
Right, a hospital, nursing home, or any place, rehab centers. So they need those skills to be able to.
And then the second program is a school-based, so more for putting students...
Right, students that would like to
with
work in
children.
the schools, work with the children, whether they're special kids or normal kids with just articulation and language disorders, then that's another track that they can take.
We're seeing lots of interest in the field, and it is growing tremendously. We see the demand in our own program. I think speech language is our most selective program, admitting less than 10% of the students who apply. Why is there such interest in speech disorders? Is it something we're just becoming aware of? Or are we just developing new techniques to deal with it?
Well, I think one of the things that we're seeing is from the pediatric community, we are now having, we're saving kids that before were not saved, you know, with the technology. So those kids are alive, but they may end up having some speech or language delay or disorder. So that may be one of the things that is allowing us to see more, so then the demand becomes greater. And then something else that we're seeing is the fact that some schools are now not, like before you could say, well, these kids would go into a special school, but now it takes a lot to be in a special school. You can be mainstream, so then you see more in the mainstream.
Regular classroom.
Regular
right?
classroom, so maybe people are more aware of it in that sense. So that has increased the demand for speech and language. In the medical field, then, for example, in the area of dysphagia, that becomes an issue if the person is not able to swallow because they may end up with pneumonia. So that keeps the patient in the hospital. So having a speech pathologist to work with that patient to get them out of the hospital makes that increase in demand.
In those kinds of situations, are you teaching people how to swallow again? Are they having to relearn some basic skills?
In some cases, yes, but learning usually takes time. So usually what you do is to try to teach compensatory strategies. So for example, when we swallow, we actually swallow on both sides. It's not a straight shot. So if somebody has a stroke and one side gets weak or paralyzed, then you can ask the person to turn to that side to close it, and they can still use the other side. So as a speech pathologist doing one evaluation and determining that, you can get that person to start swallowing. They can get out of the hospital, and then the therapy starts as an outpatient or in a rehab center.
Okay.
So there are compensatory strategies, and then there are the remediation strategies that can be applied. But at that moment, you try to see, can the person eat safely and not develop a pneumonia from aspiration.
Okay. Let me shift gears. We're getting short on time. Part of being LaSallian is also involving your students in your research, and I know you're a great proponent of that. What kind of work are you doing with the students, and you've presented at conferences with students?
Yes,
Tell us a
and
little bit
every semester I have one or two students in the 444, the student research program.
These are undergraduate students.
Undergraduate
that you're working
students.
with. And you also work with our graduate students.
Yeah, so usually the undergraduate students, enroll in the 444, and then we have actually in November, we're presenting one of the research that was done at the national conference that I did with the two students here. And we presented in the past in other conferences. So we I let them pick what is it that you want and kind of guide them through, and it usually becomes a presentation, a poster or something. So.
Okay, are those conferences all over the country? Are they pretty much regional? Where do you go?
Well, we've presented at the Pennsylvania Speech and Hearing Association, and we've also presented at the American Speech and Hearing Association, which is a national conference. So this one is coming up in Orlando, and we're presenting a very interesting one because it's an app that it's 99 cents, and it does the same thing that another equipment that we have, which is $25,000. So we just compare them and see if they had some type of correlation, and they seem to do the same. So
okay. What exactly does the app do?
Well, it's measure the voice. So you give a sample into the voice, and you go, ah, and then that gives you measurements, the fundamental frequency, which is your pitch, and the noises and all of that. And then the equipment also does the same thing. So we're trying to see, we kind of conducted a study to show that, you know, you may be able to use that 99 cents, and, you know, at least in the schools and places where we don't have the equipment. You may not use it for research purposes, but at least, you know, you can have.
But if you needed a diagnostic
right,
in a
numbers to
quick
go by,
area.
you know, to measure before and after treatment, you know, they correlated very well. So.
Who developed the app? Was it?
I couldn't find the person. It's somebody in Serbia.
Okay.
So
it wasn't necessarily.
I couldn't get the person to kind of get all the numbers that I wanted to get more specific in terms of the numbers, but as is, that's the way people are going to take it. So I wanted to make sure that there was some use for it.
Okay.
So that I did with 2 students, and that's the one we're presenting at the.
Going to be in November in Orlando.
November, Orlando.
Okay.
Yeah,
Well,
so.
Cesar, thank you very much.
Thank you for inviting me.
My guest has been Dr. Cesar Ruiz, who is Associate Professor in the Speech Language Hearing program here at LaSalle University. Once again, my name is Joe Marbach. I'm the Provost at LaSalle. I thank you for watching and for joining us in this inaugural show of season number 4. Stay tuned for future shows as we go forward.